Welcome to Megaphone from Medvale Media. I'm Dave Self. On Megaphone, we dig into healthcare, all aspects, all perspectives. And today, we're very fortunate to be joined by Jim Giuffre. So a little background on Jim. A number of years ago, he was with both WellMed and WebMD in the early days. After that, the president and chief operating officer of HealthWise, where they provided significant content for a variety of avenues for consumers to consume information about healthcare, all evidence-based. Currently, he is an angel investor advising early stage companies, as well as the chairman of the board for St. Luke's Health Partners, a financially and clinically integrated network in Boise, Idaho. And with that, Jim, welcome to Megaphone.
Thank you, Dave. Excited to be here and have a conversation with you.
Well, let's start off with having you fill in the blank for us a little bit. Can you share with us your greatest hope and greatest concerns for the growth and the use of artificial intelligence in healthcare?
Yes, I kind of divided into the providers and the patients, if you will. And so I think AI has a huge potential to reduce the burden and the complexity for providers to really allow them to spend much more time with what they really got into medicine for, and that's for the relationship with their patients. And for the patients, I think the opportunity is for them to be a much more involved partner in making healthcare decisions in partnership with their primary care physicians and really everybody else in the healthcare system. And I think of AI as this little assistant sitting on your shoulder that you can tap into whenever you need it to get you the information right at that moment where you want to have a conversation with your doctor, with other healthcare professionals to make better health decisions and to really become a true partner in those decisions.
So if that's the angel, is there a devil on the other shoulder that could be a challenge for artificial intelligence in healthcare?
Yeah, great question, Dave. On this side is, there's a significant amount of fear and trepidation that AI will bring, much greater misinformation or disinformation, as a part of the whole healthcare, learning curve. Security, is a big issue as a potential. Yet, I think if this is done with really good, strong leadership, as we really have in the healthcare systems, and people's good, hearted approach to being able to make it workable, I believe that will calm some of those fears, particularly as people get used to the idea, just as they have, in the early days of the iPhone and electronic medical records and everything else that we now experience in healthcare.
Well, if we unpack that just a little bit more for a moment, please. When we talk about the advantage and maybe some of the challenges, certainly there's a safety component, but artificial intelligence models, especially large language models that are producing information back based on the prompts, can often have what they call hallucinations. And those are real and they're not infrequent in many models. So is that a concern from your perspective for the consumer who's actually using the information to make decisions about their health?
Yeah, Dave, I think it's a legitimate concern for the consumer because it's difficult to, sparse through medical information, particularly with the language that's used. That's, very complex and using a lot of medical terminology and jargon. So I think if you take that with the idea that you'll have that conversation as an informed consumer with your doctor and other healthcare professionals, they'll be able to really provide guidance on, based on their education, background, and training as to what's really evidence-based versus what's either misinformation or disinformation. So that would be my encouragement is that that little assistant on your shoulder is really to be done in partnership with your partners in the healthcare system.
Assistant on your shoulder would be a great name for an album too, Jim. I'm gonna jot
I,
that one down for my next band.
I like it.
So at HealthWise, you led the modernization of evidence-based content creation and then how people were able to access that. If we go into the Wayback Machine for a minute, would AI have had a role in that? And if so, how do you fast forward that based on some of the comments you've already made today?
Interesting question. In the early days, prior to digital information, everything was done in books, a variety of different books that HealthWise produced. So it would have been difficult to really have AI be up to date, in the moment based on the latest and greatest evidence-based health information. But I think in the mid 90s, when really the whole industry, in particular HealthWise, went into digital information, it really gave us the opportunity to update and provide evidence-based medicine on the fly. And I think the real differentiator for HealthWise was to be able to do it in consumer terms, evidence-based medicine in plain language, and that was really applicable to where that person was in their healthcare journey. And that's evolved literally over the last 30 years to really become an assistant and an asset to really have meaningful conversations with your doctor about what's going to be the best treatment, what's going to be the best medicine, what's going to be the best opportunities for me.
Jim, in the introduction, I neglected to mention the fact that you also have deep history in public health.
I do.
And,
Yeah.
and in fact, served on the board of the Idaho State Department of Health and Welfare in various capacities over the years. So, have you considered how public health and even Medicaid programs could benefit from leveraging artificial intelligence, like enhancing services or easing labor and staffing shortages, accelerating processes?
I was a huge fan and a very big believer in the Centers for Disease Control, particularly during the pandemic. And to be quite frank, I thought they did less than a stellar job of really educating the public about the risks and the opportunities for treatment, et cetera, around COVID and all the other issues. So I think with what we have today with AI, that information can come directly more from the CDC, but from all the sources of information, plain language that could help the consumer be able to be a partner in that shared decision making as to what preventive activities they should take advantage of and whether there are treatments that could take advantage of it for them. So I see a huge opportunity for the consumer, be a much bigger partner in all of the public health issues that we're dealing with today. And this won't be the last pandemic, Dave, as you know. So the opportunity to really take advantage of getting the information in a timely way through AI will be critical in public health.
Interesting point, because when you bring up the CDC as an example, there were so many other sources of information, and people were like an old-fashioned pinball, bouncing back and forth between the different sources of information. It got very confusing, and people were chasing whatever the last thing they heard. So do this, follow this, worry about this, don't worry about this. Um, are you saying then that maybe AI could consolidate all the information appropriately into a more cohesive message that people could rely upon?
Absolutely. And in addition to in a cohesive way, it can be personalized and tailored. So, for me as a 71-year-old male, as an example, with this history of health issues and background of family history and DNA as an example, it can be very personalized to me as to what my treatment options are, my preventive options, much different than, for example, a younger person like you, Dave, in terms of your healthcare journey, for it. So that way we can parse the data or parse the recommendations in a way that's much more meaningful to me. And then I would obviously have a conversation with my doctor, based upon, in this case, it's a male, his understanding and background of how well he knows me. So yes, is a short answer to the question.
Personalization of healthcare, a place that artificial intelligence could potentially be very valuable. And you started touching on what it would mean, for instance, to you. As we think through that, is it an enhancement, an augmentation of the care provider role as we move forward, thinking in terms of something that could assist the physician, the nurse practitioner, et cetera? Is that on your radar screen as being a potential positive outcome?
It is. And to what I reflected at the beginning, the potential for the provider. Imagine how much data they're inundated with in evidence-based medicine they're reading in their journals or through their digital capabilities. I can't imagine a sole doctor being able to absorb all that, make sense of it, and then be able to parse it out based upon where their patient is, on their care journey. Well, the doctor has that little assistant, on their shoulder as well. So knowing the background and the health history of their patient, they can do a much better job of synthesizing that information and being able to provide it back to their patient in a very meaningful way that's unique and personalized and tailored to them. And it eases the doctor's burden of having to go home that night and research, maybe hundreds of medical journals to really pull out the pearl of wisdom that is specific to this particular patient. So I see a huge decrease in their burden and not having to, at that moment in time, take advantage of all this information, but really have it personalized and tailored. And then in a discussion with their patient, the patient's brought up to speed and has a discussion about what are my best treatment options based on my preferences, my values, and my personal history.
I know that there are pilots being done now that assist care providers. So as you point out, when they go home or when they leave the clinic environment, they still have work to do. And one of the pilots actually provides suggested responses to the information in the physician or the nurse practitioner or the APP's inbox. They don't have to use it, but it's a suggestion. And sometimes that can indeed accelerate the process, easing the burden of responding to all of the things in their email queue.
Exactly. And it allows them to be much more personalized to their patient, as well. If that what's in their inbox or what's on their assistant's shoulder is all about my learning style, whether that's auditory or visual or some combination of both, they don't have to figure that out, at that moment and on the fly. AI can really say, hey, Jim Giuffre is this kind of learner. So send him these 3 videos, relative to his decision making, because he'll pay much more attention to those short videos than reading a long tome on evidence-based medicine.
So really building a personal profile for the patient and being able to personalize the response or the care advice along the
Ex-
way. Is that
Exactly. Yeah, exactly right, Dave.
so? We've talked a little bit about the clinical side and some of the things that the angel and the devil might provide along the way. Hopefully, more angel. What about administration? You've got deep knowledge, both currently as chair of a financially and clinically integrated healthcare network. Also, your background and you've seen inside of many, many, many payer organizations and provider organizations across the country. What are your thoughts around how artificial intelligence could begin to change or disintermediate the current system?
Yeah, Dave, I think that if you thought about the promise 30 years ago of the electronic medical record, it really still hasn't been realized. In all the readings I'm doing and personal conversations I have with physicians and other healthcare practitioners, they're burnt out on some of the challenges of the promises of what was to become of the electronic health record. So the data is there, but extracting it and putting information in is literally a pain for them. And so the opportunity exists for artificial intelligence to have all that done in a much more streamlined and facilitated way, probably through, just voice recognition. So instead of having to go back after a patient visit and enter all this data, which now takes, I'm told, about 40% of a physician's time, imagine that that's done right at the point of care in a verbal way that's being captured by the electronic medical record, immediately put into it. So the physician does not have to follow up and spend his or her evening hours. Now I'm told somewhere between 4 to 6 hours just catching up with the electronic medical record. And I'm aware of, including at St. Luke's and other health systems, they're using AI tools to allow that to happen. And I know there's a variety of them. I think the one at St. Luke's is called Ambient. And at least early feedback I'm hearing is the clinicians are very excited about the time saving that's happening with administrative tasks through that, and really allows them to have a much different conversation with their patients. Instead of, we've all heard the complaints about, the doctor trying to carry on a conversation and looking at the screen over here and losing, that personal eye contact with their patient. So I'm hopeful. That's just one minor example. And I think there are probably 100 other ones where AI can take the burden of the administrative task really away from the practitioner.
So really marrying the input plus the back end for a more rational, cohesive system.
Yeah. I mean, I've thought about this and I've read about it and I'll give credit where credit's due in just a minute. But imagine that you're a doctor and just prior to the patient, coming in for the visit, instead of having to go pull the chart and try to rifle through, literally tens of pages of information about the patient, the doctor says to the little assistant, "Hey, I'm meeting Jim Giuffre. You know all the information about him. What are the highest risks that I should be dealing with him today? And what are you seeing in his profile based on the data that he's entered or that the pharmaceutical record has entered that I should close a gap in care?" Imagine that being done in 30 seconds. And now the conversation takes on a whole different, I can relax as that provider and really address the top of line issues for both me as the provider and quote Jim as the patient. I'm sorry I keep referring to myself, but it's a good way to be able to, personalize.
Well, it's quite all right. You said, imagine me as a doctor. The only way I'd be a doctor is if someone imagined it. But what about the rest of the industry? There are a lot of different applications. We have a system of delivering and funding care currently that's based on a paper-based system. So when you start removing some of those heavy paper processes, a lot of touches. Every touch has a cost. Do we get more efficient? Does it change the players that are currently in the game? Is there a future for thinking differently about how we provide care, pay for care, and assure that the patient receives the best care?
Yeah, Dave, I'm going to tell you about in the Chat GPT book by written Dr. Robert Pearl out of Kaiser. He was the former CEO of Kaiser's Permanente Group, and he really makes a case that for a group of patients, uh, the idea that we can track through AI symptoms and measures that might be leading, for example, to heart attacks. In a way that there's no way that the physician could pay attention to all those parameters across their entire patient population. But a matter that's all being done in the background. So when that patient shows up to the office, the physician's well prepared to say, you are at high risk for a heart attack, within the next 30, 60, 90 days. It's exactly what Kaiser did in the early implementation of some AI tools and found that they could save 30% of heart attacks from occurring by just using that data, AI intelligence, and then having the practitioner be able to take advantage of it and use the preventive tools at his or her disposal to really guide the patient. Is that where you were heading with that question, or did I misdiagnose your question?
No, I think you've begun to touch on it. So again, that's in the clinical environment. We still have another piece or two of the industry where care management is provided by the payers and other processes. So are there ways that we may leverage even further beyond the electronic health record, beyond electronic submission of claims, beyond electronic payment of claims? Are there ways for us to reimagine a more streamlined system?
Yeah, and in a really broad context, imagine removing all the administrative burden of the clinical side from the physician, so that, as we have already talked about, they could focus really on healthcare, for the patient. And I will be very direct in that our current payment structure is antiquated, it's complex, it's difficult for consumers and for providers really to understand. And I'll just use the example of, we all get these EOBs, explanation of benefits, with this big title. This is not a bill. So as a consumer, you're saying, well, pardon the expression, what the hell is it? And trying to parse it through. I think AI could simplify the billing structure and the explanation of it, both to the provider and to the patient in a way that allows them to really understand what they got and what they need to pay for, and different than the way that it's delivered today. And I think we're just on the precipice of really trying to understand that. And Dave, I have a bias that, I think the two players in the healthcare system are really providers and patients. Everybody else is really adding cost and marginal value, to the system. So if we can take and parse out the middle players, in the system and really allow all of that communication to occur between provider and patient, I think we would save a lot of cost, we would improve healthcare, and we would decrease the complexity dramatically. So I'd love to see AI applied to our current payment structure within healthcare, because I think it's antiquated, it's expensive. We have a $4 trillion, healthcare bill in the United States, and we're not getting nearly the outcomes we should be for the amount of money being spent. So I know it's a broad statement. I know there's a lot of work going on in a variety of different channels to look at how do we ease the complexity of the payment system.
Interesting point, Jim, because the current payment system is based on something that was all paper, and there was a need for someone to manage the paper,
Yeah.
and whether it was snail mail or delivered in person to someone to pay the bill, that had to transpire. That was the record, the one truth of what had transpired.
Yeah.
And so with the continued emergence, not just of EHRs, but the electronic submission of claims, which has been around a long time. Going back to the 90s when it was a bulletin board style where you would post a physician would post a claim out there that would be picked up by an insurance entity, and everything would be paid. There was still an EOB and an explanation of payment, EOP, because we can't have enough TLAs in healthcare. It's third, so yeah, three-letter acronym for those of you keeping up.
Yeah.
So it is interesting. It's a friction that may not need to exist today if we're thoughtful about how we deploy the latest tools.
Yeah. I mean, think about that assistant on the patient side, be able to say, well, here are the services I receive. What do I really owe for this? And is this commensurate with what the industry standard is? Because Dave, you know as well as anybody in the industry, for the same procedure, you could be tens of thousands of dollars apart, depending upon where you get that procedure and who's providing it. So if we can inform the patient, they might be a much better uh, have much better capability to ask the right questions, to make the right payments at the right time, and in a way that's probably a lot less expensive than it is today.
Well, Jim, I'm going to ask you our crystal ball questions. So please gaze into your crystal ball for us. Take a look into the future. Tell us what you see as the major challenges in healthcare in the next 5 years.
Number one, Dave, I think it's the heart and mind change that has to occur, with the providers and with patients both, because this is, the new technology that takes a long time for people to get accustomed to and adopt. So I think really strong strategic leadership, with guiding people in heart and mind changes at the clinic, heart and mind changes when the patient, comes into the office or through a telehealth visit or through other technology, is really our biggest challenge ahead of us. I think the technology is going to be there, without question. In fact, in many ways, it's already there. In some cases, it's the adoption of that technology different from the way medicine is practiced today, and that's the opportunity for the future. So I think very strong leadership is going to be required to really kind of push this agenda, have a mindset that we're not backing away from it, we're not going to compromise from it. And I think that you'll see, both value accrued to the provider and value accrued to the patient, and then it will, uh, steamroll, through the opportunity. So that's one big challenge: the heart and mind change. Um, the other is just the cost of integrating the technology into the current, in my opinion, antiquated systems. So our electronic medical record vendors are going to have to get better at accepting the ability for AI to improve their tools. And that's a heart and mind change within their organizations, because right now they're making a lot of money with the way that they're currently doing business with electronic medical records. So when they do change management, it's going to require them to think differently in terms of the way they sell their product and manage their product and service their product.
Well, I'm going to abuse the host's privilege here and ask one quick follow-on question. Based on some of the things you've touched on in the last comment, do you see that artificial intelligence potentially is going to be continuing consolidation in the industry between the various parties? Is there the potential for fewer players over time, almost a more homogenized environment?
Dave, I think if you're looking in the crystal ball, yes, longer term than shorter term. I think right now you're seeing really the infancy of AI, particularly from some of the major technology companies. You know who they are, Apple, Google, NVIDIA, and on down the line. And you have all these small players, trying to capture their piece, of the pie. So I think it's going to be a while before there is a consolidation and acquisitions that really improve the tools, for the benefit of making it easier for us to adopt them.
Here come the
And Dave,
disruptors.
if you'll allow me, I'd like to just make sure I miss the opportunity for patients to take advantage of this AI assistant and participate in shared decision making, with the doctors. I think it was back in 1967, the Surgeon General said the greatest untapped resource in the healthcare system is the patient. And so we give them the tools and the resources to get smarter in language that they can understand. They're going to be in a much better position to have incredible, productive conversations with their physicians. And I think they'll be much more inclined to adopt the behavior that their clinicians are recommending, really as it relates to the overall improvement of their health and fitness, nutrition, stress management, social networks, et cetera.
Absolutely. You and I both have the privilege of hanging out frequently with a lot of professional physicians and professional care providers. And universally, the message is you should be your own healthcare advocate. And to the degree that AI can assist in that, there can be real value for all of us. We've been speaking today with Jim Giuffre on artificial intelligence in healthcare. Thanks for joining us. And join us again next time on Megaphone from Medvale Media.